Donor blood processing. Before donor blood can be used for transfusion, it undergoes a series of thorough tests to ensure its safety and compatibility. These tests are grouped into several categories, each serving a specific purpose in the screening process. Blood type and compatibility testing. The first step involves determining the donor's blood type through ABO testing. If any discrepancies arise, they must be resolved to confirm the correct blood group. Following this, Rh testing is performed, including a special procedure called weak D determination for donors who initially test negative for the D antigen. This helps identify individuals who may have a weak expression of the Rh factor. Antibody screening. Donor blood is also screened for clinically significant antibodies. If such antibodies are present, the unit cannot be used to prepare fresh frozen plasma. However, it may still be suitable for producing platelets and cryoprecipitate, as these components contain only a minimal amount of plasma. Serologic testing. Serologic tests are conducted to detect infections that may be transmitted through blood. These include the rapid plasma reagin test, commonly used to screen for syphilis. Testing for antibodies to Trypanosoma cruzi, the parasite responsible for Chagas disease. Screening for viral diseases. A comprehensive panel of tests is used to detect viral infections. These include Hepatitis B surface antigen, which indicates active infection. Hepatitis B core antibody, suggesting past or ongoing infection. Hepatitis C virus antibody, used to identify exposure to hepatitis C. Human immunodeficiency. Virus types 1 and 2 antibodies, which screen for HIV. Human T lymphotropic virus types 1 and 2 antibodies, which detect HTLV infections. Nucleic acid testing. To enhance detection sensitivity, nucleic acid testing is performed for several viruses. This includes HIV type 1, hepatitis C virus, West Nile virus, hepatitis B virus, Zika virus,